So, good afternoon, friends. This is Dr. Puneet Samaya, Assistant Professor, SGSITS Indore. I'm submitting this topic hypertension to 6th faculty induction program, which is organized by HRDC DAVB Indore. So let's move to the definition of hypertension. So what is hypertension? So according to the World Health Organization 2003 data, it has been defined as the blood pressure, systolic blood pressure to be 140 mmHg and the diastolic to be 90 mmHg. So if the blood pressure is above this, then it is called as hypertension. But it is observed that if the blood pressure is above 120 by 80 mmHg, then also there is a risk of some cardiovascular diseases. So here a formula I have provided for the various components of blood pressure. So blood pressure is equals to cardiac output into total peripheral resistance. So from where this cardiac output comes? So this cardiac output comes from the heart rate and the stroke volume. Okay, the heart rate and the stroke volume provides the cardiac output, and the total peripheral resistance is developed by the plasma volume and also by the receptors of angiotensin. Then what are the causes and the mechanisms underlining the hypertension? So there are various types of hypertensions, like primary, which is also known as essential, then renal, then pulmonary, then endocrine, and the last one is some other forms like cardiovascular, neurogenic, drug induced, pregnancy induced hypertension. So one by one we will discuss about these types and their causes. So first is the primary or essential hypertension. So why it is called essential hypertension? Because it is not a medical condition. Okay, it is not due to any medical condition, but the high blood pressure is due to some lifestyle conditions like obesity, or genetic conditions like family history, or some unhealthy diet taking, like taking junk foods or coke or some soft drinks like those. So this condition worsens over time and can cause life-changing complications that include brain aneurysm, dementia, heart attack, heart failure, kidney diseases, malignant hypertension, stroke, and also vision loss. Now the second one is the renal hypertension. Renal means kidney. So the hypertension which is associated with the kidney disorder is known as renal hypertension, and it is a secondary type of hypertension. So here a medical condition is there, that is there is a stenosis in the arteries which provide the blood to the kidneys. So as a result, due to the renal stenosis, renal artery stenosis, the kidney do not get enough blood, and they react or respond this condition, medical condition, by releasing a hormone renin, which rises the blood pressure. Then third one is the pulmonary hypertension, and it happens when there is a pathological changes in the heart and lung coordination of the blood. So in this case, in pulmonary hypertension, the blood vessels which supply the blood to the lungs are increased in the muscle mass. Then comes the endocrine or hormonal hypertension, and majorly this type of hypertension is due to the adrenal gland disorders like primary aldosteronism, then glucocorticoid excess, and pheochromocytoma paraganglioma syndromes. Okay. And then the fifth one is the other forms like first is the cardiovascular. So if there is a long term condition of high blood pressure persisting, then uh, it can lead to heart failure or or conduction arrhythmias, and that need to be controlled. Then neurogenic condition, which applies whether the true origin of the hypertension is neural. Okay, so here the primary underlying cause or issue is the efferent or efferent nerves, which are passing through the central nervous system, and as a result, these afferent and efferent nerves transmit some signals which leads to hypertension. And then the drug induced hypertension, so some drugs also are known to cause hypertension, like non-steroidal anti-inflammatory drugs, alcohol intake, cocaine, caffeine, estrogens, which includes in the birth pills, nicotine, like tobacco, nasal decongestants, the drugs which we put in the nose of children or the adults, that also causes increase in blood pressure. Then migraine medicines are also responsible for them. And the last one is other forms is pregnancy induced hypertension, which is known as preeclampsia. So during the pregnancy of the females, this type of hypertension occurs, and it is known as preeclampsia. Now this is the classification of the drugs which are given during the hypertension to lower the blood pressure. So these are the 10 categories. First is the diuretic, second is the ACE inhibitors. ACE means angiotensin converting enzyme inhibitors. Then angiotensin blockers, that is receptor blockers, AT1 receptor blockers. Then direct renin inhibitors. Then calcium channel blockers. Then beta adrenergic blockers, beta plus alpha adrenergic blockers, central sympathomimetics, and vasodilators. So diuretics, there are three categories. The thiazide like diuretics like hydrochlorothiazide, chlorthalidone, and indapamide. Then high ceiling diuretics category, furosemide, etc. And potassium sparing diuretics like spironolactone and amiloride. ACE inhibitors category include the drugs like captopril, enalapril, lisinopril, perindopril, ramipril, fosipril, etc. And angiotensin AT1 receptor blockers like losartan, candesartan, irbesartan, valsartan, telmisartans are in the market. Then direct renin angiotensin renin inhibitors like L-skyrine. Then in calcium channel blocker categories, the drugs are verapamil, diltiazem, nifedipine, phalodipine, amlodipine, nitridipine, and lecidipine, etc. Beta adrenergic blocker category of drug includes propranolol, metoprolol, atinoprolol, etc. Then the beta plus alpha adrenergic receptor blockers drugs are labetalol and carvedilol. Then alpha adrenergic blocker drugs are prazosin, terazosin, doxazosin, phentolamine, and phenoxybenzamine. And central sympathomimetic drugs like clonidine, methyl dopa, etc. And the vasodilators like arterial and arterial plus venous vasodilators. So arterial vasodilators are hydralazine, minoxidil, and diazoxide, and arterial plus venous is sodium nitroprusside. So this is all about the topic of hypertension. Thank you so much.